Good morning, everyone. My name is Shazia Khan, and the unit we'll be doing today is effective communication skills in health and social care. Now, we're looking at learning outcome 2 today, which is to understand the communication needs and preferences of individuals. So the indicative content learning outcome 2 is to how to determine an individual's communication needs and preferences, observation, assessment, agreement, review, liaison with carers, relatives, key people, ability, person-centered autonomy. And we're going to be looking at approaches used when promoting effective communication, verbal, written, non-verbal, formal, informal, advocate interpretation, the use of ICT aids, adaptations, argumentative approaches, British Sign Language, and Makaton, services and resources access to promote effective communication, speech and language therapists, support groups, networks, and audiologists. Now, does anyone remember what we did in Learning Outcome 1, which was yesterday? We looked at communication, didn't we? Verbal, non-verbal. What else did we look at yesterday?
Communication with signs.
Yes, signs, yes. Why is that so important?
Body language.
Sorry, body language. Why is that so important? Facial expression. We looked at effective communication, and we have watched a video on you know, the level of English you're at as well.
Yeah.
Why do you think body language is so important?
It's important because it passes direct information to the to others.
Yeah, so it's through body language, isn't it, really? The fact that we're able to do something through body language. So, you know, they're able to identify how someone understands something through body language. Key terminology. Right, that is to go back. Key terminology. So what are communication needs and preferences of individuals? Understand the communication needs and preferences of individuals is crucial in providing effective care. Different sources emphasize various approaches. So with the different sources that we've got is firstly to identify the needs, determine communication requirements based on abilities, disabilities and illnesses. Why is it so important to identify the person's needs?
Because that's when you will be able to provide the care the person needs.
Yeah, you're able to know and provide the care the person needs. Okay, and you're able to identify if the person's got any sort of disabilities or any illnesses.
Yeah.
Person-centered, this is to gather information through trial and error, seeking how they prefer to communicate. Individualized approach, this is to establish communication methods by choosing the right moments and place. And the standard 6 guidelines, which is skills for care, offers guidance on identifying and then addressing any sort of communication needs. And person-centered care is where you obtain details about communication, language, needs and preferences. Comprehensive understanding is consider various styles, needs, wishes and preferences. It's important to understand the person's language needs in case you are not there to support them. So, for example, if you need to provide an interpreter for them, you will be able to provide that interpreter because you will know what their language needs are. Effective communication. Effective communication is important in person-centered care. Health and social care workers need to be able to understand the individual's care's needs. They will need to use effective listening techniques and ask appropriate questions. You can't just be abrupt and rude and just say, oh, you know, and not ask about, you know, what their needs are. Why is it so important to be listening properly and identifying appropriate questions to ask them. Is everybody different?
Yes.
So are you supposed to cater the question around every individual differently?
Yes.
Yeah.
Yes. So everyone has different needs. Everyone has different, care needs. Why is effective listening important? Why is the listening important?
It's important so that you'll be able to understand. You have to concentrate so you understand how to care for them, what their needs are, to be able to meet their needs.
Yeah. And you need to make sure that the person you're talking to is feeling comfortable with you and able to, identify what their needs are. Because, if you're not listening and you're talking to other people, you're not really listening to the patient or the individual, are you?
Yeah.
So you need to be able to be listening actively. They would need to be able to discuss alternatives for care and treatment with the individual and provide information that will allow the individuals to make informed decisions. They will need to support individuals to communicate their needs and preferences in relation to the care and encourage them to express their concerns and expectations about the care. This will ensure that individuals are empowered in the provision of their health and care. So there's communication, speaking people with learning difficulties. So it's a video on communication, okay? So let me just share this video with you. I don't know if you'll be able to hear it like this. Can you hear this now? Just can you hear this?
Oh.
No.
No. Okay, so I have to stop sharing and then I'll put the video on because I think you have to share the video with the voice.
This short
Can you
film
hear
is
it
about
now?
communication. Having
Yeah.
a communication need.
Yes.
Yes.
Okay. So this is a video about communication
This
skills,
short
okay?
film is about communication. Having a communication need may include not being able to express yourself, not understanding information that is said to you, not understanding information that you read. We all know that bad communication is the main reason for problems, errors and distress. Volunteer champions Carol, Stuart and Ian will tell you more.
People communicate in different ways and use different methods. Communication is about how we relate to others. It does not have to be seen as complicated. The message we give other people need to be understood by the person who needs to understood them.
Good communication is really important. One of the biggest challenges faced by people who have a learning disability is making themselves understood or understanding others. Ray Birdwhistle was a behavioural psychologist. He was one of the first people to study body communication in the 1940s. His studies found that 20% of communication is verbal, 80% of communication is non-verbal, words are 7% helpful or effective, tone of voice is 38% helpful or effective, non-verbal clues are 55% helpful or effective.
Some people cannot say what they think or feel. Some people cannot talk. This does not mean they do not think or feel.
Times are changing. Family carers are often more educated and informed now. This needs to be respected. even if the person who has a learning disability is in some form of care. Family carers should be included in discussions, and their knowledge of the person should be listened to.
It is important that managers and people running services do not just assume that they know what families and carers think. If the person is not able to make decisions, the managers and people running services should arrange best interest meetings. It is critical that GPs are involved in these meetings.
Many GPs will have known the person during their younger years. A lot of information and knowledge gets lost when the person becomes 18 or an adult.
GP or primary care is a lifetime service. They need to make sure everyone remembers that good communications is so important in help people to have good health.
Some people harm or hurt themselves. This can be a way of saying they are unhappy or confused. Everyone's life has a value. It is wrong to judge the value of life because it is complicated or costs money. We should all remember MCAP's report called Death by Indifference.
You can see from that video that, oh, sorry.
Some people actually use BSL to make detectors.
Oh, sorry about that video. Can you all see the slides now? Yeah.
Yes.
Yes. So you can see from that video, why do you think that video was so important in regards to people with special needs and, you know, able to identify why communication is so important to them?
It makes them feel welcome with you.
It will what, sorry?
It makes them feel welcome. They feel welcome with you.
Yeah, it makes them feel, you know, there's different ways of communication, and that is one of the ways where, you know, sometimes people don't talk, but they're able to communicate through the body language and things.
Yeah.
So, you know, for them, if they can't speak or anything, they can communicate in different forms. And it's so important, communication in the health and care profession, that we're able to identify their needs. Theories of effective communication. So communication theories aim to explain how communication works. Communication theories fall into three main categories: linear models, interactive models, and transactional models. So the linear models, these look at simple flow of information from the sender to the receiver. Models include Laswell's model and Shannon and Weaver's model. Linear model tends to concentrate on the person who is sending the message, the content of the message, the channel of the communication, and the receiver. Some, like Shannon and Weaver's model, introduce the idea of message being encoded and decoded, for example, put into words by the sender and interpreter by the receiver. The advantage of this model is that they are simple, as in figure 1. Below, the disadvantage is they do not consider feedback from the receiver. So who The communicator says what, the message, in which channel, the medium, to whom, the receiver, and with what effect. Interactive models. In interactive models of communication, the sender sends a message to a receiver who interprets that message and gives feedback to the sender. The communication cycle theory in figure 2 below, which was developed by Charles Berner in 1965 and then revised by social psychologist Michael Aguirre in 1972. The cycle begins when someone decides that they need to communicate with someone else. They decide what to say or send the message. The receiver receives the message and interprets it. The receiver may then give an answer or feedback to the sender, and the cycle begins again. Other interactive models include Schrem's model 1954. The advantage are that the model deals with interaction. It includes feedback from the receiver of the message. It also includes interpretation of the message. It does not, however, consider that communication is continuous and there may be multiple senders and receivers. So that diagram identifies the message, decoder, interpreter, decoder, and then the feedback and the source. And this is Schrem's model of communication, includes feedback loop and the process of encoding and decoding and interpretation. The next one is transactional models, and these look at communication as an ongoing and changing process where each element is dependent on the other elements and each person reacts depending on contextual factors such as their background, experience, attitudes, and beliefs. Models include Barlund's Model 1970 and Julie Wood's Transactional Model 2004. An advantage is that these models take account of all factors that affect communication. A disadvantage is that they are more complex to understand and use. You can explore the different models of communication through further sources. So we have the Communication Process 2013 is the models of communication. The process is available at the communicationprocess.com, models of communication, and the source is E.K. and Lee Hunt, Principles, Theories, and Methods of Effective Communication. So if you need to have a look at the communication process, that's the link to go to. So an activity, think about a recent situation where you've communicated with someone. Analyze your communication by applying the 7 C's and identify you could have done better. So you've got the 7 C's there in that diagram. Correct, clear, concise, concrete, considered, complete, and courteous. What can anyone think of a situation where they've communicated with someone and analyze your communication by applying the 7 C's and identify if you could have done better? So is there anyone that's communicated with someone recently and how they've applied the 7 C's?
Yeah, the first one, which is correct, is giving the correct information to the receiver.
Yeah.
And it have to be clear and simple so that the receiver can understand the exact what you want to give out.
Okay.
And the consequence is it?
Concise.
It should be what you are talking about. You don't have to sugarcoat it to make it too complex.
Yeah.
It should be exactly what you want. And you have to concentrate so that the person will know how serious or how important the information you are giving out is. And consider that you have to consider the age, the disability, how the person process information, because some people are slow in processing information. So you have to take your time. If the person have sign languages, how you have to consider all those things. That how are you going to channel that information to the person? and complete is the person really understood what you were giving.
What kind of information you were giving across. And then you've got courteous as well.
That's how what tone or how did you give the information? Was it in a rude manner? Was it in a comfortable environment that the person was able to feel comfortable to receive what you were supposed to?
When we look at the 7 C's, do you think in communication the 7 C's are important?
Yes, 1 minute. I have something to say or add. If it's fine.
Do you think they're important to identify, you know, how someone is feeling or communicating with someone?
Yes, it's very important.
Yes. Yeah. Okay, so 2.1, we're looking at 2.1, the importance of determining an individual's communication needs and preferences. Unless you find out about the communication needs and preferences of individuals, you'll not be able to communicate effectively with them. It is important to establish how the individual prefers to communicate and how they are able to communicate. Depending on the individuals that you work with, they may have a range of communication needs, from speaking a different language to sensory problems such as hearing loss or issues with understanding. It is important to review communication needs on a regular basis. There are a number of reasons why communication needs and preferences can change. For example, if you work with individuals who have dementia, their understanding may deteriorate and you will have to adjust communication to continue to meet their needs. So you have to change. You know, if someone has dementia, they're forgetting things and you have to change to their needs. There are different ways you can assess or review individuals' needs and preferences for communicating. You ask the individual. Many individuals will be able to tell you how they prefer to communicate and to identify their own communication needs. For example, they may tell you they have some hearing loss, but can lip read, and then you can take account of that when you are communicating with them. It may be more difficult where an individual has limited communication skills or speaks a different language. Also, individuals may not know the range of resources or aids available to support communication. For example, they may not realize that an interpreter or a visual aids are available to them. You observe the individual. So it may be possible to observe the individual to determine their communication needs and preferences. You can observe their body language to check whether they are comfortable with and understand what is being communicated and the method of communication. You can watch their response to different ways of communicating. This is particularly helpful when they are trying new resources or methods to see if you can improve communication. Ask other key people. So there may be other key care workers, professionals, family and friends who have been working with or who are close to the individual and already understand the issues around communication. Talking to them may help you find out the best ways to communicate. You should be aware, though, that just because they are communicating with individuals and have been for some time, this does not mean that they are necessarily communicating the best way. People who are closely involved, especially family and friends, may not notice the changes in the individual that require an adjustment in communication. You should also make your own assessment, and talking to other key people can support this. Read the individual's file or care plan. And this is really important. That's why there is a need for care plans to be put in place. Where care is ongoing, any specific communication needs should be recorded in the care or medical notes for individual or in their care. This will be a good source of information. Where the individual has specific difficulties in communicating, the notes or plan may include a communication guide or passport, which is a document that sets out communication needs and preferences. You should be aware that records may not be up to date and the communication needs can change, so you will still need to assess the individual's communication needs yourself. 2.2. Compare and contrast the approaches used when promoting effective communication. People communicate in a variety of different ways, and this is important and to be able to use and adapt these methods as appropriate. Main approaches are verbal communication, so that could be speaking words and making noises. Written communication, and that could be letters, emails, notes, or flashcards. Non-verbal communication, that could be body language, touch, and behavior. The use of interpreters or advocates, that could be someone who speaks on behalf of the individual. Communication aids, that could be technology or the use of pictures, and sign language or McCartan, where signs are used to communicate or support communication. Verbal communication. Most of us communicate verbally using words to have conversations with people. If individuals are unable to say words due to physical disabilities, for example, they may have a stroke or cognitive issues, they may not be able to make sounds. These sounds can be used to indicate agreement or to identify choices. For example, when you are using verbal communication, there are strategies you can employ to ensure that what you are communicating is properly understood by the individual. So things like vocabulary. So words should be carefully chosen. It is always better to use simple, straightforward words if possible. Using long words and different jargon is quite confusing for the individual. Using slang and local words can also make understanding difficult, and people may not be confident enough to ask about what is meant. Why is the tone of your voice so important when you're communicating? What does the tone of your voice identify?
Yeah, the tone of your voice can identify rudeness, not respecting them or respecting them. So it's good to use a good tone. Like shouting, that's disrespecting and rude.
Can you hear me?
I can hear you. It's only
Yes.
you. You're not responding to all I'm saying. That's why I asked that question.
Sorry?
I can hear you, but there's no response to all I've been saying or what I'm asking.
I can't. What were you asking?
Yeah, because the topic that you finished that topic, that's where I asked something and we're another one. So
I can't
that's
hear
why
you clearly. I can't hear you clearly.
I don't know what happened then. Because I've been
If you
asking
need,
questions.
what did you need to ask, Oyi?
Oh, I can't even remember.
Do you want to put it in your chat?
That is okay.
Yeah, you put it in your chat. I'll answer it in the chat, okay?
But I don't know if the whole class cannot hear me or we can't hear each other properly. I think something is not right.
We just started hearing you
cool.
now. We've not been hearing you before, but we've started hearing you.
Yeah, I couldn't hear you before, but I can hear you now, but it's not still quite clear.
Yeah, it's not so clear. That's the problem.
Yeah.
I've been talking and I've been trying to ask something each time you ask something, but when I realized that they've not been responding to me. That's why am I really in the class?
Might be the network.
Your line is breaking up.
Yeah, your line's not very clear, Oi.
All right.
So if you just put a message in the chat and then just say you're trying to ask me something, then I'll go quiet and then I can hear little bits, okay?
All right, then, no problem.
Okay. So the tone of your voice is really important because of verbal communication, as it shows emotion behind the words. So, if you're feeling upset, you're feeling happy, that tone of voice, identifies. Also, the tone of voice identifies if you're annoyed or if you're angry or you're stressed. So a tone that is soft and gentle shows sensitivity and understanding, and a confident and energetic tone can convey enthusiasm and encourage people to do something or become involved. So the pitch of your voice. Pitch is important as some people may not respond well to a particular pitch or may have trouble hearing it. Very high and very low pitched voices can be difficult to understand for people with some hearing loss. For example, the volume needs to be adapted according to individuals' needs and wishes and to the situation and location. Some people are sensitive to volume, some need a high volume, and perhaps due to hearing or cognitive problems, and others find noise painful and irritating. The acoustics in a room can affect how clearly speech can be heard. So, if you're in a big room, sometimes, words come across and you can't hear them clearly because of the size of the room. Listening is an important part of verbal communication. It is good speaking all the time and not listening to what the other person is saying. Active listening involves nodding and using facial expressions to indicate understanding and agreement, making eye contact and looking interested in what the individual is saying. If you sat there and you're sat with the individual, why is it important to, identify that you are listening actively? Does it make the person feel comfortable and interested?
Yes.
Yes, please.
Yes.
Yeah. Why do you think it's so important you show that as a healthcare professional that you are listening to your patient or the individual?
It helps to identify how caring you are.
Yeah. That's important though. If you have an elderly patient, for you to identify that you are caring, it makes them feel welcome, doesn't it? It makes them feel like you are listening to them.
Yeah, through your expression, they will understand that you are listening to them and you are able to care for them appropriately.
Yeah, if they've got any problems or anything, you are listening to what they are saying, because people, some elderly people, they struggle to listen because of hearing and other things, and if they're wearing hearing aids, the volume affects it as well. So be prepared to repeat what you said if the person does not understand. So that's a summary to this. Your first time, but find ways to say things differently rather than using the same words over and over again. Be aware that some individuals may lip read, and you can support this by speaking clearly and facing them so they can see your face. Active listening. One of the models of active listening that is often used in health and care profession is SOLA, which has been developed by Gerard Egan, a psychologist, in 1975. The acronym stands for, the S stands for sit squarely. So more often today this is changed to sit at an angle, because sitting straight onto someone can be seen as confrontational. What is important here is that you can see the other person properly and they can see you. The O in SOLA is open posture. So this means no fold arms or cross legs, because that can appear defensive or as if you're not interested. The L is lean towards the other person. So leaning forward towards the other person slightly shows an interest in what they are saying. If you are in the public, allows you to talk more quietly. E is for eye contact, which contains interest and sincerity and helps you see what the other person is feeling so that you can respond appropriately. And then R is relaxed. So a relaxed posture shows the person that you have time to listen to them and encourage them to talk. You need to make the person feel comfortable. Written communication. So written communication has the advantage that people can look at it again if they do not understand it, but the disadvantage is that you may not be able to be there to help explain and check their understanding. Written communication is particularly useful if you have a lot of information to give someone, details of ongoing care and treatment, or if it is specific information that they need to remember, such as the time and day of a doctor's appointment. Writing things down can also be useful when individuals are unable to hear or unable to speak. You may be able to write things down for them, or they may be able to write things down for you. Where words are difficult to understand, you may use a diagram or drawing. Where individuals do have communication problems, a set of flashcards with words or pictures can help them communicate their needs. For example, if they want a drink or if they want something to eat. Non-verbal communication. This is important communication in, as what we say, body language, gestures, facial expressions, eye contact, and just where and how you sit and stand all convey meaning. Our body language is often unconscious, so if we say something that we do not believe or do not mean, it will often give us away. A person who frowns, looks at the floor and sits with their arms folded gives off negative message. A person who sits or stands upright and who smiles and makes eye contact is more approachable and less threatening. If you stand too close to a person, this can make them feel intimidated, especially when they do not know them very well. Body language that supports effective communication includes an open and relaxed posture, facing the person but not standing too close, smiling when appropriate, but also other facial expressions to show feelings such as concern, sympathy, or reassurance, and using eye contact can show that they are interested in the person and what they are saying. It's really important to identify to patients, probably more elderly and young patients, or patients that have got any sort of learning difficulties, that you are listening to them and you have that body language where you are smiling and positive. So in summary, body language, it is important to be aware that the body language can be different for different cultures. For example, in some cultures, too much eye contact contains a lack of respect. In addition, some individuals will find it difficult to read body language, and their own body language may not support what they are saying, maybe due to physical or cognitive impairments. You need to be flexible with your body language and adapt this in the way that you might adapt verbal communication to enhance understanding. You also need to be observant so that you can build an understanding of the individual's body language and increase your understanding of what they are trying to communicate. Also, like we mentioned, in some cultures, why is it important to respect others' cultures? Why do you think it's so important? And then, why do you think it's so important? Why do you think it's so important to respect others' people's cultures?
It helps to identify how important they are.
Yeah, how important. And
Yeah.
have you got anything? Or Portia?
I'm just thinking that respecting culture, someone's culture, it makes them feel okay when dealing with you, because for example, my culture, from where I come from, my culture, I know each individual culture is different from each other. So
culture is very important.
Yeah. So by respecting each culture, it makes us, it means I'm not discriminating your culture. Why are you not discriminating mine?
Yeah, it's so important because you're able to respect each other's culture.
Yeah, it's each other's background as well.
Yeah, because certain things in certain culture is not acceptable. Things like, touching a woman in certain culture is not acceptable. Shaking a woman's hand is not acceptable.
Some cultures, men cannot change a woman if you see they don't like it. It's not acceptable.
Yeah.
So and we need to respect that. Otherwise it's not going to be going on well.
Yeah, I think you have to respect every culture as well. It's important that you respect, especially if you're working in that profession, you need to respect everyone's culture. So touch is another way to communicate with people. Some people feel uncomfortable with touch, and in some situations it will be inappropriate. But health and social care, touch can be used to show concern or to gain someone's attention. For example, touching someone's arm may alert them to the fact that you are there. Patting someone's hand can show compassion and reassurance. Gestures are also useful to communicate. For example, you might point to an object or person to show the individual where something or someone is. Waving indicates that you are leaving, and miming actions such as eating, drinking, or brushing teeth can be used to ask the individual a question or explain what is happening. Behavior is another non-verbal way to communicate. You can often tell whether someone is happy, sad, or angry by the way they behave. Your own behavior in health and social care role needs to be professional so that people have confidence in your ability. Individuals, especially those with mental health issues, may behave in a particular way or show challenging behavior. There are usually reasons for this, and if you link behavior to particular situations, for example, this is a good way of understanding the individual's needs. The use of interpreters or advocates. In some situations, it may be that the person is able to communicate, but that they are unable to understand them. This could be because they speak a different language, or because you do not know the person and do not understand their ways of communicating. In these situations, it can help to have an interpreter who speaks the language and can translate, or an advocate who supports the individual in their communication or speaks for them. When working with interpreters and advocates, always remember that it is the individual that you are really communicating with. Do not talk as if you were not in the room. Make eye contact with them and address questions to them. Communication aids. There are various aids to communication for individuals that have different communication difficulties.
Yeah.
These include communication charts and books, where person points to a picture, photograph, or symbol to indicate what they mean. These can be developed for the individual with pictures or symbols grouped around particular activities relevant to them. Picture exchange communication systems, which is called PECs. These are systems where individuals have a number of pictures and exchange the pictures for something they want. It is used to support the development of communication as well as means of communication. Braille. Braille is a writing system which allows blind people to read. It uses a system of raised dots representing letters and words. And Braille is available throughout the healthcare profession when they've got signs and symbols up as well, or if you need to explain everything. Symbols or pictures on signs or packaging convey information. For example, fire exit signs or hazard symbols or cleaning fluids and other symbols are examples. Speaking aids have an artificial or recorded voice that speak letters, words, or phrases. These range from very simple devices that have a single or very few phrases or words for more complex devices with hundreds of words, which are usually arranged in levels. Sounds can be played by the individual pressing a single button or clicking on a picture or through complex touch screens. And there is a need for this because people have a lot of needs that we need to address. So there's a need to use all these aids. Sign language or Makaton. British Sign Language is referred to as BSL, is a language used in the UK primarily by individuals who are deaf or who have a hearing impairment and their families. It consists of finger and hand signs that are used to represent each letter of the alphabet and are used to spell out words. An interpreter can be used where one person does not understand sign language. Makaton is a language that uses signs and symbols to support spoken communication when this may not be clear. It uses gestures that indicate particular activities or needs and written symbols. Individuals can use these as much or as little as they like, and it is very simple to learn, even for young children. It is primarily used by children and adults who have learning or communication difficulties as their main form of communication or to support speech. And the Makaton website is just there where it shows you how it's used, how it helps with communication and what kind of difficulties. So there's a link there that you could go on the slides. 2.3 is to describe services and resources access to promote effective communication. So to compare and contrast different approaches to communication, you need to understand the advantages and disadvantages. So verbal face-to-face communication, the advantage is most people have some level of verbal communication, even if it sounds rather than words. Little preparation is usually required, can be used with individuals or groups. The disadvantage is you cannot revise what you have said after you have said it. Verbal communication can become emotional. Individuals need to share a language and understanding for it to be effective. and when to use it. When supporting individuals in health and social care settings, most work will involve face-to-face interaction and exchanging information with colleagues and case conferences or professionals from different agencies. I think this carries on from equipment not required for face-to-face. It can get immediate response. It is personal. It helps to develop relationships. Any misunderstandings can usually be sorted out quickly, can be used in lots of different situations, and it supports person-centered care. The disadvantaged people do not always plan what they're going to say, need to ensure tone is suitable, and you do not come across patronizing. For example, harder to hide real feelings such as irritation. Then you've got ritual communication, which advantages it can be planned in advance and revised. It can be useful for giving complex information or instructions or large amounts of information. It can be left as a reminder for an individual, and it can be used to overcome speech. And the disadvantages, it can be misinterpreted if the sender is not there to explain it. There's no tone or body language to support what is being said. It can be time-consuming to write down large amount of information, and it depends on the person being able to read it. And when it's available, is flashcards for simple communication to overcome speech and hearing impairment when this meets the individual needs, and to communicate information that someone needs to remember, for example, a doctor's appointment. Non-verbal communication advantages, so can support verbal communication and increase understanding of what is being said. It can transcend language barriers, can be used to indicate consent or disagreement. So, for example, things like nodding or shaking your head can help people with hearing impairment to understand messages. The disadvantage is that can only be used on its own for simple, relatively simple messages. It can be culturally specific, so different cultures have different gestures, as we mentioned earlier. Cannot be used for formal communications, cannot be misunderstood, as difficult to use with groups, and it's used to add emphasis on what you are saying in a situation, and use in active listening to show interest in what the other person is saying. For interpreters, the advantages are, if we have interpreters, is to support communication with individuals who speak other languages, including sign language, where you do not know it. It enables individuals to communicate for themselves. The disadvantage is having a third person in the conversation makes it more difficult to build a relationship with the person. When you have interpreters, does the patient or the person feel comfortable sometimes?
Yes.
Do they always feel comfortable with an interpreter there?
Not always.
No.
No, not always. Yeah, you're right.
Yeah, but
Why do you think they don't always feel comfortable?
Because sometimes they get confused who they are listening to. Are
Yeah,
they listening to
yes.
you, or they are listening to the interpreter?
Yeah, so it's important that you make them feel, welcomed as well. It's difficult in situations like that. Confidential information may not be shared by the individual. So when there's no common language and you need to establish an individual's needs and preferences. The advocates, and these are people that have communication needs in regards to a disability or something. So the advantages are independent and support the individual in putting their views across, can enable individuals in their person-centered care process, and can ensure the individual's views are put forward. And the disadvantage is having a third person in the conversation, as we stated above, makes it difficult to build a relationship with the person. Confidential information may not be shared by the individual and only used in more formal situations, for example, meetings about the care. So where the individual cannot speak for themselves, needs an advocate or needs support to speak for themselves, and you want to know their needs and preferences. And this is used with individuals you do not work with regularly, for not worked with before, so that they're aware of their communication preferences. Communication charts. So these charts and books, advantages of these are that it can be useful for individuals to indicate things they need or want when they're unable to speak. It's a simple method of communication. It can be used by anyone working with the individual. And the disadvantages, it takes time to develop for the individual, and it's more useful for simple communication or wants and needs, but not more complex conversation. And it's used for everyday wants and needs with individuals. Then we've got the picture exchange communication, which is PECS. The advantages of this are, as above, can be used for individuals to indicate things they need or want when they are unable to speak. Simple method of communication, can be used by anyone working with the individual, and can also be used to develop the individual's communication skill. The disadvantage, it takes time to develop for the individual, and most useful for simple communication of wants and needs, but not more complex conversation. And it's used for everyday wants and needs with individuals. Then we've got symbols. Some advantages of symbols and pictures, can be used on signs and notices. Some symbols and pictures are universal or easily understood. Things like, the toilet sign or fire exit sign. And then the disadvantage is only used for simple communication. And what it's used for is to signpost important areas, information everyone needs to understand. Speaking aids can overcome, advantages are that it can overcome speech impairment and allow individuals to speak for themselves. It's simple to use, but can produce complex sentences and information, and it can be operated by individuals with limited movement. The speaking aids, a disadvantage is that voice can sound very robotic. They have no emotion, as the sentences are put together with single words to be used in different contexts. And it's used to enable speech and communication in individuals who cannot communicate in other ways. Sign language, advantages of sign language, that it can be used to overcome speech and hearing difficulties, and it's relatively widely used and understood in the care industry. Disadvantages, it needs to be learned by individuals and those working with them. Not everybody knows how to do sign language, so it's sometimes quite difficult. Disadvantages, individuals needs to be able to spell words and put sentences together. It can exclude others from conversations when they do not understand sign language, and it is there to overcome speech and language difficulties. And then we've got the final one, which is Mercaton. This can be used to overcome speech and hearing problems. It's simpler to learn than sign language and often used with sounds to help develop language skills, and it can be used even by very strong young children. Individual does not need to be able to spell, and it needs to be learned. That's the disadvantage. It's there to overcome various communication difficulties and develop communication skills. 2.4 services and resources to promote effective communication. We've already mentioned some resources and services that help to promote effective communication. These include things like interpreters and advocates, which is local health organisations should have details, and the NHS should have their own guidance on interpreting in health and social care, and that is on the NHS website. The advocacy people are a charity providing the advocacy service to individuals, and they have their own website, which is called www.theadvocacypeople.org. Communicating books and boards, so organisations such as the National Autistic Society give information resources to support making communication books and boards, and they have their own website called autism.org. Also, we have communicationpassports.org, which provide templates and guidance for making communication passports. Picture exchange communication systems called PECS, and information about PECS can be found at PECS.unitedkingdom.com. Speaking aids, livingmadeeasy.org.uk give information and sell community aids. Macinton, you can find out about Macinton on the Macinton charity at Macinton Aid. In addition to these, there are speech and language therapists which work with individuals to improve their communication skills and finds for them to communicate effectively. And they can be accessed through the GP, sometimes through schools or colleges that the individual attends or privately. The professional body for speech and language therapists is the Royal College of Speech and Language Therapists, gives advice and details how to find therapists in your local area, which is called rciit.org. Audiologist is to do with related to hearing problems, and they may be able to help. They identify hearing problems and advise on ways to overcome these. And GPs normally refer people to the audiologist. Support groups and networks. So there are local and national support groups available to support people. Things like, for example, local groups using sign language like Macarthon, local surgeries. They provide health centres and advice centres and have information about local support groups, such as, you know, if you've got Alzheimer's or the Royal National Institute for Blind People, RNIV, which supports people with sight loss. Also things like, you know, diabetes. There's support groups that are available at the local GP surgeries, and sometimes hospital have these support groups as well, which help support people with certain illnesses. Information on the internet. So as we've mentioned, there's lots of information on the internet about all kinds of communication problems and how individuals can be supported. Do you think that we as a country, or we provide enough information for people to help them? Enough resources? Do you think we provide enough resources on illnesses or how to, you know, become better if you've got diabetes? And do you think we provide enough information?
Yeah.
At the hospital, do you think we provide enough information? Or do you
not
think,
really,
or do you think,
not
do you
really.
think in some areas we could provide more?
Yeah, they can provide more because not they don't have. Not every time they
Yeah,
have it, that's what they need.
yeah. I think we can provide more
Yeah.
in some areas. You
Some
know,
areas.
things like, you know, cancer and things like that, illnesses that don't have that much against them. I think we should provide more services and more support for people.
Yeah.
So in this section, you've learned about why it's important to assess individual communication needs and preferences, how to assess individual communication needs and preferences, approaches to promoting effective communication, and services and resources available to support effective communication with links and, you know, to get onto websites. These are the references used for today's session. So we've got a lot of references you can refer to here, and you can also link to these references to get any sort of support or anything, or if you want to read about communication, individuals' communication, effective communication. And you need to be referring to ebooks and journals on Moodle for this unit. Further reading, communicating with people with learning disabilities, and 3 have must skills for health and social care. Any queries or any questions, again, learner work at ukvarsity.co.uk, and submission of your assignment will be done after the sessions are finished, which is 2 weeks after, and the learner work at ukvarsity. Thank you for attending today's session, and thank you for your patience, and sorry that we've gone over the time, but also, has anyone got any questions before we finish this session? And then your next session is next week then. Any questions, anyone?
Don't have any questions.
No? So have a read of the resources that are available on here, because there's quite a lot to take on, and all the resources and extra additional resources are available on Moodle, and have a look at the links. So it will help you when we go through your assignment. This will help you to do more on your assignment area.
Thank
Okay?
you.
Thank you for your patience, and thank you for attending. Any questions before?
No, no from
No.
my side.
Okay, thank you for attending.
Thank you very
Thank you.
much. Thank you.
Thank you.
Thank
And
you
I
for the
will
information.
see you next week, okay?
Okay.
Thank you.
Thank you.
Okay,
Thank you.
bye.
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 Bye.